There is a pill sitting in your medicine cabinet right now. You probably took it this morning or yesterday. Maybe it is part of your daily routine, so routine that you do not even think about it anymore. And that pill, the one your doctor said was safe, the one the television has been telling you is gentle and effective for decades, is quietly, slowly, and silently destroying your liver. Not because you are doing anything wrong, not because of your age, not because of genetics, because of specific, fixable chemistry that happens inside the liver of every adult over 60 who takes this medication regularly. Chemistry that no one warned you about. Chemistry that your annual checkup almost never catches until the damage is already done. A study published in the Journal of Hepatology followed over 5,400 adults for 7 years. The researchers found that adults over 60 who use this common pain medication regularly had a 276% higher rate of early liver enzyme abnormalities compared to adults under 45 using the same medication at the same dose. 276%. Same pill, same dose. Completely different biological consequence after 60, 276%. Let that land for a moment. And here is the part that should alarm you most. Liver damage does not hurt. Your liver has no pain receptors. It can lose 40, 50, even 60% of its functional capacity, and you will feel nothing. Nothing at all. Until one day you feel everything. Stay with me until the very end of this video, because I am not just going to tell you what is destroying your liver. I am going to tell you exactly what to switch to. Specific, natural, clinically validated, and available to you starting today. I am Dr. Edward, specialized in senior health with over 15 years of dedicated clinical experience working with adults over 60. What I am about to share goes against what many doctors will tell you. But I have seen it patient after patient, year after year, and I refuse to stay silent any longer. If this information matters to you, please hit the like button right now. It takes 1 second, and it tells YouTube this information needs to reach more people who are taking this pill every single day without knowing what it is doing to their liver. Let me explain exactly what is happening inside your liver, because the biology here is critical. Once you understand it, everything else in this video will make complete sense. The medication I'm talking about is acetaminophen. You know it as Tylenol. It is the active ingredient in over 600 over-the-counter and prescription medications in the United States. Tylenol, NyQuil, Dayquil, Theraflu, Excedrin, many prescription opioid combination drugs like Percocet and Vicodin. Acetaminophen is everywhere, and most people taking it have no idea how it is processed inside the body. Here is what happens. When you take acetaminophen, your liver does the primary work of breaking it down. The vast majority, about 90%, is processed safely, but the remaining 10% is converted by your liver enzymes into a highly toxic compound called NaPQI. N-acetyl-P-benzoquinone imine, NaPQI. In a healthy young liver, the body neutralizes NaPQI almost immediately using an antioxidant called glutathione. Glutathione binds to NaPQI and renders it harmless. This process works perfectly well in younger adults. But here is what changes after 60. And this is the most important piece of science in this entire video. Glutathione production declines with age. A landmark study published in the American Journal of Clinical Nutrition found that glutathione levels in adults over 65 are on average 30 to 40% lower than in adults under 40. 30 to 40% lower, which means when your liver produces NaPQI from acetaminophen, it has significantly less glutathione available to neutralize it. The NaPQI that cannot be neutralized does not disappear. It binds directly to liver proteins and liver cell membranes. It causes oxidative damage. It triggers hepatocyte death, the death of actual liver cells. And because this happens every time you take the medication, every single dose adds another layer of damage to a liver that is already working with reduced capacity. A research team at Johns Hopkins published findings showing that regular acetaminophen use in adults over 65 was associated with measurable increases in ALT and AST liver enzymes. These enzymes are the alarm signals your liver sends out when its cells are being damaged. And in this study, the enzyme elevations were occurring at doses well within the standard recommended range. Not overdoses, standard doses, the doses on the label, standard doses, causing measurable liver cell damage. In adults over 60, this is what no one tells you when they hand you a bottle of Tylenol. Now I want to hear from you. Type your age in the comments right now. Just your age. I want to understand who is watching this video and whether this information is reaching the people who need it most. Type your age in the comments right now. Now let us go through the 10 most important things you need to know about acetaminophen and your liver after 60. And then I am going to give you the specific, clinically validated alternatives. We are counting from least critical to most critical. And number 1 will change how you look at your medicine cabinet forever. Number 10. You are almost certainly taking more acetaminophen than you think. This is the foundational problem. Most people believe they take acetaminophen only when they take Tylenol. But acetaminophen is the hidden active ingredient in an enormous number of common medications. A person who takes 2 regular-strength Tylenol in the morning, a NyQuil capsule at night for their cold, and 1 Excedrin for a headache in the afternoon has taken over 2,500 milligrams of acetaminophen in a single day. The maximum recommended daily dose is 3,000 milligrams for adults over 60 according to updated geriatric guidelines. That person is dangerously close to the limit without ever opening a dedicated pain reliever, and stacking is the rule, not the exception. Research from the University of North Carolina found that 44% of adults who were surveyed did not know that their combination cold, flu, or sleep medications contained acetaminophen. 44%, nearly half, unknowingly doubling and tripling their daily dose. The action: read every single label, every single one. Before you take anything, look for the words acetaminophen or APAP. If you see them on more than one product you are taking in the same day, you need to rethink that routine. Number 9. Alcohol and acetaminophen after 60 is a combination your liver cannot safely manage. Many adults over 60 have 1 glass of wine with dinner, 1 beer in the evening, an occasional cocktail on the weekend. This is considered moderate alcohol consumption, and for most health metrics, it is relatively benign in moderation. But here is what changes when acetaminophen is present. Alcohol and acetaminophen compete for the same liver enzymes. When both are present, the liver is forced to process acetaminophen through an alternative pathway that produces dramatically more NAPQI. Not the standard 10% converted to NAPQI, potentially 25 to 30% converted to NAPQI, with the same reduced glutathione reserve we already discussed. A study published in the British Medical Journal found that adults over 60 who combined even moderate alcohol consumption with standard dose acetaminophen had liver enzyme elevations nearly twice as severe as those who took acetaminophen alone. Nearly twice as severe. From 1 glass of wine and 2 regular-strength Tylenol. Most people have no idea this interaction exists, because no one tells them, because it seems like such a small thing. 1 glass of wine, 2 Tylenol, an ordinary evening. The action: if you drink any amount of alcohol, do not take acetaminophen within 12 hours. This is not about being extreme. This is about the specific biological reality of what happens in an aging liver when these 2 compounds arrive together. Number 8. Fasting or skipping meals makes acetaminophen dramatically more dangerous for your liver. This one surprises almost everyone. When you fast or skip a meal, your liver glycogen stores drop, and when liver glycogen drops, one of the secondary consequences is a reduction in available glutathione. The liver needs adequate nutritional substrate to maintain glutathione synthesis. No food, less glutathione. Research published in the journal Hepatology found that adults who took acetaminophen in a fasted state had NAPQI accumulation rates 60% higher than those who took the same dose with food, 60% higher, from simply skipping breakfast. For adults over 60 who may not have large appetites in the morning, who may practice intermittent fasting, or who may simply not feel hungry when they wake up and take their medications, this is a direct daily risk they are not aware of. The action: never take acetaminophen on an empty stomach. If you take it in the morning, eat something first, even something small, oats, a piece of fruit, a handful of walnuts. Give your liver the substrate it needs to protect itself. Number 7. Common medications taken by adults over 60 directly interfere with acetaminophen's safe processing. If you are over 60, there is a significant chance you are taking at least one of the following: a statin for cholesterol, a proton pump inhibitor for acid reflux, a blood pressure medication, a diabetes medication, or an anticoagulant like warfarin. Multiple studies have shown that several of these common medications share liver enzyme pathways with acetaminophen. When the liver is simultaneously processing acetaminophen and a statin, for example, the competition for CYP450 enzyme availability can slow acetaminophen metabolism, increasing the time NAPQI remains active in the liver. A study in the Journal of Clinical Pharmacology found that adults over 65 taking 3 or more prescription medications alongside regular acetaminophen had liver stress markers elevated at levels 89% higher than adults taking acetaminophen alone. 89%, and the researchers noted that this was occurring at doses most physicians would consider completely routine. Most physicians prescribing the statin and the blood pressure medication are not thinking about how those drugs affect the safety of the over-the-counter Tylenol you are also taking. It is no one's fault. It is a coordination gap in how we manage medications in older adults. But it is your liver that pays the price. The action: bring every single medication you take, prescription and over-the-counter, to your next doctor visit and ask specifically about interactions with acetaminophen. Ask your pharmacist as well. Pharmacists are an underused resource, and they know drug interactions better than almost anyone. Number 6. The liver damage from regular acetaminophen use is cumulative and largely invisible until it becomes serious. This is the nature of the enemy we are talking about. Most medication side effects give you feedback. They hurt. They make you feel nauseous. They cause a rash or a headache or something that tells your body a problem is developing. The liver does not do this. The liver's enormous reserve capacity and its absence of pain receptors means it can sustain significant cumulative damage across months and years while you feel completely normal. Research from the American Liver Foundation estimates that drug-induced liver injury, of which acetaminophen is the leading cause, accounts for more than 50% of acute liver failure cases in the United States. More than 50%, and the vast majority of those cases begin with what seemed like routine use. A study in the journal Gut found that liver biopsy analysis in adults over 65 who had used acetaminophen daily for more than 2 years showed measurable hepatocyte fibrosis, that is, early scar tissue formation, in 31% of participants. 31%. With no symptoms, no warnings, no abnormal liver panels in many cases. Silent scarring. 31% with measurable liver fibrosis, taking a medication they believed was completely safe. The action: ask your doctor to include ALT, AST, and GGT liver enzyme tests in your next routine blood panel. These are simple, inexpensive markers of liver cell stress. If you have been using acetaminophen regularly for more than a year, these numbers deserve to be part of your health picture, right here, right now. I need to stop and ask you to do something. If this information is opening your eyes, if you had no idea your Tylenol was doing this to your liver after 60, please hit the like button right now. Right now. It costs you nothing, and it gets this information in front of the people who desperately need it. Type yes in the comments if you or someone you know takes acetaminophen regularly. I want to see how many people this is reaching. Type yes, and please share this video. Think of one person in your life, a parent, a sibling, a friend, someone over 60 who has Tylenol in their daily routine. Send this to them today. You may be doing them one of the greatest favors of their life. Now let us get to the most critical items on this list, and then I will tell you exactly what to switch to. Number 5. Your liver's detoxification capacity after 60 is already under significant pressure even before the acetaminophen arrives. Your liver performs over 500 biological functions. It processes everything you eat, drink, breathe in, and absorb through your skin. It manages cholesterol, it regulates blood sugar, it produces clotting factors, it filters waste from the blood, it processes every medication you take, and all of this capacity declines with age. Liver blood flow decreases by approximately 40% between ages 25 and 75. Liver enzyme activity decreases. Hepatic reserve, the liver's backup capacity, shrinks. The organ is working harder with fewer resources. A study published in the Journal of Gerontology found that liver processing efficiency in adults over 70 was on average 35 to 45% lower than in adults aged 30 to 40. Same organ, dramatically reduced capacity. And into this already taxed system comes a daily dose of acetaminophen demanding immediate liver processing. Think of it this way. In your 30s, your liver was a 6-lane highway. Acetaminophen was one car. By your 70s, that highway has narrowed to 3 lanes due to natural aging, and you are still sending the same car through every day at the same speed. Traffic backs up, processing slows. NAPQI sits longer. Damage accumulates. The action is not to add more stress to this system. It is to reduce unnecessary chemical burden on the liver wherever possible. And for pain management, there are better options, which I will cover in detail shortly. Number 4. The maximum safe dose for acetaminophen in adults over 60 is significantly lower than what most people and even many doctors believe. The standard packaging on Tylenol says the maximum daily dose is 4,000 milligrams, 2 extra-strength tablets 4 times a day, but updated clinical guidelines from the American Geriatric Society specifically recommend that adults over 65 should not exceed 2,000 to 3,000 milligrams per day, and that for adults with any history of liver stress, alcohol use, or multiple medications, even lower limits are appropriate. That is a 25 to 50% reduction from the labeled maximum, and most people over 60 have no idea. Their doctor told them the standard dose was fine. The package says 4,000 milligrams, and so they take 4,000 milligrams without concern. A study in the Journal of the American Geriatric Society found that 67% of adults over 65 who used acetaminophen regularly were using it at doses above the revised geriatric appropriate guidelines. 67%. 2/3, taking more than they should be, based on outdated information that was never updated on the label. 67%, above the revised safe limit every single day. The action: if you must use acetaminophen, target the lowest effective dose. Many adults over 60 find that 500 milligrams is sufficient for mild to moderate pain. Never exceed 2,000 milligrams total in a day if you are over 65. Count every source, not just the tablets you intentionally take for pain. Number 3. Acetaminophen's risks are compounded by chronic conditions that are extremely common in adults over 60. Approximately 37% of adults over 65 in the United States have some degree of non-alcoholic fatty liver disease. Fatty liver disease. Many of them have never been diagnosed. Many do not know, and fatty liver disease significantly impairs the liver's ability to process acetaminophen safely. Diabetes is present in approximately 26% of adults over 65. Diabetes impairs glycogen storage in the liver, which, as we discussed, directly reduces glutathione availability for NAPQI neutralization. Heart failure affects approximately 10% of adults over 70 and reduces blood flow to the liver, slowing the entire detoxification process. A comprehensive study published in the British Journal of Clinical Pharmacology found that adults over 65 with any one of these 3 conditions, fatty liver, diabetes, or heart failure, had liver enzyme elevations from regular acetaminophen use that were 2 to 3 times more severe than adults over 65 without these conditions. 2 to 3 times more severe, and all 3 conditions are among the most common diagnoses in adults over 60. The action: know your liver health status. If you have been diagnosed with any metabolic condition, fatty liver, diabetes, prediabetes, or cardiovascular disease, talk to your doctor specifically about acetaminophen use and whether it is appropriate for your specific situation. Let me tell you about Charles. Charles was 71 years old, a retired civil engineer from Dallas, Texas. He came to see me after his internist flagged abnormal liver enzymes at a routine physical. His ALT was elevated, his AST was elevated, his GGT, a particularly sensitive marker of liver stress, was more than twice the upper limit of normal. His internist had ordered follow-up tests, considered a biopsy, and mentioned the possibility of early liver disease. Charles was terrified. He did not drink. He ate reasonably well. He exercised 3 times a week. He could not understand what was happening to his liver. When I sat down with Charles and went through every single thing he took on a daily basis, here is what we found. 2 extra-strength Tylenol every morning for his shoulder, 1 Excedrin in the afternoon when the shoulder pain returned, NyQuil 2 to 3 nights a week because he had been dealing with chronic sinus congestion for months, and a statin for cholesterol that shared his liver's processing pathways. We added it up. On a typical day, Charles was consuming between 2,800 and 3,200 milligrams of acetaminophen every single day for over a year and a half. His previous doctor had never asked about over-the-counter medications, never added them up. Charles had no idea he was essentially in a daily acetaminophen overdose for his age group. We removed the acetaminophen completely, replaced it with targeted alternatives that I will describe shortly, supported his liver with a specific nutritional protocol. 8 weeks later, his ALT had returned to normal range, his AST had normalized, his GGT was still elevated but declining measurably. His internist called the improvement remarkable. Charles called it a second chance. This was not a miracle. This was removing a daily chemical assault from a liver that had been fighting for its life, and that same possibility is available to you. Number 2. The safe and effective alternatives to acetaminophen that most doctors do not tell you about. I want to dedicate significant time here because this is the reason most people clicked on this video, not just to be frightened, to be given something better. Let me go through the alternatives systematically by what they treat. For general pain, inflammation, and joint discomfort, the most clinically validated natural alternative is curcumin, the active compound in turmeric. But here's the critical detail most people miss. Standard turmeric powder from a spice jar has very low bioavailability. You would need to consume enormous quantities to get a therapeutic effect. The effective form is a standardized curcumin extract combined with piperine, which is black pepper extract, which increases curcumin absorption by up to 2,000%. A study published in the Journal of Medicinal Food found that curcumin piperine supplementation in adults with knee osteoarthritis reduced pain scores comparably to ibuprofen at 1,200 milligrams daily, comparable to ibuprofen, with no liver toxicity. For headaches and tension pain, magnesium glycinate is an underused and remarkable option. Magnesium deficiency, which affects an estimated 50% of adults over 65, is directly associated with increased headache frequency and intensity. A double-blind study in the journal Cephalalgia found that magnesium supplementation reduced both the frequency and severity of tension headaches by approximately 42% over 3 months. 42%, without a single pill of acetaminophen. For arthritis and chronic joint pain, omega-3 fatty acids at therapeutic doses have been shown in multiple studies to reduce inflammatory markers as effectively as low-dose NSAIDs. A meta-analysis in the journal Pain found that omega-3 supplementation at doses of 2,000 to 4,000 milligrams daily significantly reduced self-reported joint pain in adults over 60 over a 12-week period, with the additional benefit of reducing cardiovascular inflammatory markers simultaneously. For muscle pain and back pain, a combination of topical magnesium oil applied directly to the affected area, combined with heat therapy and targeted stretching, eliminates the need for systemic medication entirely in many cases. The pain is addressed locally. The liver is not involved. For nerve pain, which is common in adults over 60, and for which many people take acetaminophen, despite it being poorly effective for this type of pain, alpha-lipoic acid at 600 milligrams daily has shown significant efficacy in multiple studies. A study published in Diabetes Care found that alpha-lipoic acid significantly reduced neuropathic pain scores compared to placebo over a 5-week period. And for overall inflammation management, which is the root cause of most chronic pain in adults over 60, a dietary approach to inflammation reduction may be the single most powerful tool available. The Mediterranean dietary pattern, with its emphasis on olive oil, fatty fish, fresh vegetables, and reduced processed food intake, has been shown to reduce CRP and IL-6 inflammatory markers more effectively than low-dose NSAIDs in long-term studies from the Annals of Internal Medicine. And number 1, The most critical thing to understand about acetaminophen and your liver after 60. It is not the extraordinary dose. It is the ordinary habit. Every single piece of data I have shared with you today points to the same conclusion. The liver damage we are talking about is not being caused by people who accidentally take too much. It is being caused by people who take a normal amount, consistently, day after day, for months and years. In the context of an aging liver that processes it differently, stores less glutathione to neutralize it, shares processing pathways with other medications, and has less reserve capacity to absorb the ongoing damage. The danger is not the crisis. The danger is the routine. A comprehensive analysis published in the journal Liver International reviewed over 14,000 cases of drug-induced liver injury and found that the most common profile was not an overdose patient. It was an adult over 60, taking a standard dose, consistently, for an extended period, who had no idea anything was wrong. That is the most important sentence in this entire video. An adult over 60, standard dose, consistently, no symptoms, no warning, until it was serious. And here is what I want you to hold on to. Your liver is extraordinary. Even a liver that has sustained significant stress can recover substantially when the source of that stress is removed and it is supported appropriately. The liver is one of the only organs in the human body that can regenerate. Hepatocytes, liver cells can regenerate. The process takes time, but it happens. The window is open. For most people watching this video, the window is still open, but you have to walk through it. I want to tell you about Susan. Susan was 68 years old. A retired nurse from Boston, Massachusetts. A nurse. Someone who had spent her entire career in healthcare. Someone who understood medications. Someone who had given more pills than most people ever swallow. Susan came to me because she was experiencing persistent fatigue that had been getting progressively worse for 9 months, mild nausea in the mornings, a sensation of heaviness in her upper right abdomen that she had been dismissing as posture-related back tension. As a nurse, Susan knew the upper right abdomen was where the liver sat. She knew, and she was afraid to say it out loud. Her blood work showed elevated liver enzymes. An ultrasound showed mild hepatic changes consistent with early chemical liver stress. Susan's daily routine included 2 regular-strength Tylenol every single day for her arthritic knees. She had been doing this for 3 years. She had recommended this same approach to patients herself throughout her career. The label said it was safe. Her training had told her it was the safest OTC pain option. She had believed it. We stopped the acetaminophen immediately. We introduced curcumin piperine at therapeutic dose, omega-3 supplementation, and a dietary anti-inflammatory protocol. We added targeted liver support with N-acetylcysteine, which is the precursor molecule that the liver uses to manufacture glutathione. 12 weeks later, Susan's liver enzymes were back in normal range. The heaviness in her upper right abdomen was gone. Her energy had returned substantially. She sat across from me at her follow-up appointment, this woman who had given 35 years to healthcare, and she said something I will never forget. She said, "I gave this pill to so many people, and I never knew. This was not a miracle. This was removing the source of damage and giving her liver the tools to repair itself. And that exact same possibility is available to you." And then there was Barbara. Barbara was 74 years old, a retired high school teacher from Phoenix, Arizona. Barbara had been managing fibromyalgia for over a decade. Widespread pain, fatigue, sleep disruption. Her previous doctors had cycled her through various medications over the years, and she had settled into a routine of 2 extra-strength Tylenol 3 times a day, 3,000 milligrams daily, every single day. For 4 years, she came to me because her gastroenterologist had flagged concerning liver function tests and mentioned the possibility of a biopsy. She was frightened. She had tried everything for her pain, and acetaminophen was the only thing that gave her any relief. The thought of losing it felt overwhelming. I want to be honest with you the same way I was honest with Barbara. Transitioning off of a medication that has been managing your pain for years is not easy. It takes time. It takes a systematic approach. It is not something to do abruptly or alone. But here is what Barbara found when we built her a proper transition protocol over 8 weeks. The curcumin piperine combination addressed the inflammatory component of her fibromyalgia in a way that Tylenol, which does not target inflammation, had never done. Her omega-3 supplementation began reducing baseline inflammatory markers within 4 weeks. Her magnesium supplementation, which she had never tried, began improving her sleep within 10 days. And better sleep for fibromyalgia patients is one of the most powerful pain reducers available. 12 weeks after beginning the transition, Barbara's liver enzymes had normalized, and her pain scores, measured on a standard clinical scale, had actually improved compared to where she had been on Tylenol. Improved, not just equal, better. She told me that she wished someone had told her about this years ago. This was not a miracle. This was science applied with intention. And the same path is available to you. Here is your action plan. Specific, numbered, and starting today. Step 1. Audit every single medication in your home today, everything you take. Read every label. Write down the milligrams of acetaminophen in each one. Add them up for a typical day. If your total exceeds 2,000 milligrams, you need to have a conversation with your doctor this week, not next month, this week. Step 2. Ask your doctor at your next appointment to include ALT, AST, and GGT in your blood panel. These liver enzyme markers are simple additions to a standard metabolic panel. Tell your doctor you have been using acetaminophen regularly and you want a baseline liver health picture. This is not alarmist. This is responsible. Step 3. Begin transitioning your pain management to targeted alternatives based on what you are treating. For joint and general inflammation pain, start with a high-quality curcumin piperine supplement. For headaches, begin magnesium glycinate at 200 to 400 milligrams daily. For arthritis, add omega-3 supplementation at 2,000 to 3,000 milligrams daily of EPA and DHA combined. Do not buy the cheapest option. Quality matters enormously with supplements. Step 4. If you drink any alcohol, build a minimum 12-hour window between alcohol and any acetaminophen use. This is not optional. This is biological fact. Step 5. Never take acetaminophen on an empty stomach. If you take medications first thing in the morning, eat something first, even something small. Step 6. Consider adding N-acetylcysteine (NAC) at 600 milligrams daily. NAC is the direct precursor to glutathione, the compound your liver uses to neutralize NAPQI. It is available over the counter, inexpensive, and there is significant research supporting its liver protective effects in adults over 60 who have been using acetaminophen long term. Discuss this addition with your doctor. Timeline of what to expect. Within 2 to 3 weeks of reducing acetaminophen burden, most adults over 60 with mild liver stress begin to see energy improvements. Within 4 to 6 weeks, liver enzymes typically begin moving toward normal range in cases of early-stage chemical stress. Within 3 to 6 months, for adults who comply with a full protocol, including the anti-inflammatory supplements, meaningful improvement in both liver function markers and pain levels is expected in most cases. Now let me tell you the 5 mistakes people make when they try to act on this information, because these mistakes undermine good intentions every time. Mistake 1. Stopping acetaminophen abruptly when it has been managing significant chronic pain. Do not do this without a plan. If you stop your pain medication without a replacement protocol in place, your pain returns, you feel worse, and you go straight back to what worked before. Build your replacement protocol first. Start the curcumin and the omega-3s. Give them 2 to 4 weeks to begin working. Then begin tapering the acetaminophen down. Transition. Do not quit cold. Mistake 2. Switching to ibuprofen or naproxen thinking it is safer. For liver health, NSAIDs like ibuprofen and naproxen are indeed less hepatotoxic than acetaminophen, but they carry their own serious risks in adults over 60, particularly for kidney function, stomach lining, and cardiovascular health. Swapping one danger for a different danger is not the goal. The goal is the targeted natural protocol I described. Mistake 3. Buying low-quality supplements and concluding they do not work. This is one of the most common reasons people give up on natural alternatives. There is an enormous difference in quality and bioavailability between supplement brands. For curcumin, you need a product that specifies curcuminoids content and includes piperine or is in a phytosome form. For omega-3s, look for products that specify EPA and DHA milligrams combined and are third-party tested for purity. Cheap supplements frequently contain insufficient quantities of active compounds and will not produce the results the research demonstrates. Mistake 4. Not telling your doctor. Some people worry their doctor will dismiss this concern or tell them Tylenol is safe. If that happens, show your doctor the studies. Bring printed research. Ask specifically about your liver enzyme levels. Ask specifically about your individual dose. You deserve specific answers for your specific situation. If your doctor dismisses your concern without engaging with the evidence, that is a conversation worth having more than once. Mistake 5. Feeling responsible or ashamed. If you have been taking Tylenol regularly for years, believing it was the safe choice, that belief came from reasonable sources, from packaging, from physicians, from advertising, from cultural consensus. You were not reckless. You were trusting information that was incomplete. The problem was not you. The problem was an information gap that has existed for decades and that the medical community has been slow to communicate clearly. You are not broken. Your liver is not broken. The information you were given was broken. Let me recap all 10 points one final time. Number 10. Acetaminophen is hidden in over 600 medications, and you are almost certainly consuming more than you realize. Number 9. Alcohol combined with acetaminophen after 60 causes dramatically amplified liver damage even at moderate amounts. Number 8. Fasting or skipping meals increases NAPQI toxicity by 60%. Number 7. Your other medications interfere with acetaminophen's safe processing in ways most doctors never discuss. Number 6. The liver damage is cumulative, invisible, and progresses silently across years. Number 5. Your aging liver's processing capacity is already 35 to 45% lower than it was at 40 even before the acetaminophen arrives. Number 4. The maximum safe dose for adults over 65 is 25 to 50% lower than what the label says, and 67% of older adults are exceeding it. Number 3. Chronic conditions common in adults over 60, fatty liver, diabetes, heart failure, make acetaminophen 2 to 3 times more dangerous. Number 2. Curcumin piperine, magnesium, omega-3s, alpha-lipoic acid, and NAC are clinically validated alternatives that work without liver toxicity. And number 1. It is not the extraordinary dose. It is the ordinary habit, day after day, year after year, in a liver that processes it entirely differently after 60. Here is my challenge to you. Commit to just 3 actions, not all 6. 3. Starting today, audit your medications, ask for a liver panel, and begin one targeted alternative supplement based on your specific pain type. Just those 3, starting today. Your liver is extraordinary. It processes every meal you eat, every medication you take, every toxin you encounter, every glass of wine, every supplement, every breath of imperfect air. It does this silently, continuously, without asking for your attention, without sending you pain signals, without complaint. It has been doing this for you every day of your life, and it deserves more than a daily chemical burden that it was never designed to carry in the quantities and combinations it is being asked to manage. You are not broken. Your liver is not broken. The information you were given was broken, and now you have better information. Please subscribe to this channel. I release new health information for adults over 60 every single week. Ring the notification bell. Type in the comments what 3 actions you are committing to starting today. I read every comment, and your commitment makes follow-through more likely. Share this video with one person in your life who takes Tylenol regularly. One person. That is all. You may be giving them a gift they will never be able to repay. Aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.